I'm Bob LiVolsi, and we are Vaccine Systems, established to fight pandemic 2 years before COVID-19. Headlines this winter scream that the speed of vaccine deployment has never been so important. While vaccine availability is one issue, processing speed plays a big role, and even once enough vaccine is available, mixing or reconstituting will remain a major bottleneck. Doctors vaccinating at UC Davis tell us they have waited hours for vaccine to be defrosted and reconstituted. CVS pharmacists dedicated to reconstituting mixing at Pfizer COVID vaccination sites here in Austin tell us it takes 5 to 8 minutes per 6-dose vial, and that the speed of patient waiting lines depends on the speed of reconstitution. Dangerous vaccination mistakes can arise as well through manual process. For example, 42 given the Regeneron antibody treatment instead of COVID vaccine in West Virginia. Examples of other reconstituted vaccines with bad and sometimes deadly outcomes include measles or MMR vaccine. Infants died in American Samoa, South Sudan, Syria, and elsewhere when the wrong diluent was mixed with MMR vaccine. Fortunately, there is little risk of that with COVID vaccines since they are never intermingled with other medications. Wastage is another costly problem. In January, the French Health Directorate projected as much as 30% of COVID vaccine would be wasted. While that has not been the case in the US with COVID vaccine, it's because US COVID vaccine that would otherwise be wasted has been given to available low priority patients, depriving, unfortunately, high priority patients of much needed doses. Memorial Hermann, the Woodlands Medical Center, experienced an example of a cause of wastage. The hospital reported in a public statement in January that the team thought enough doses to administer to those who were scheduled to come in and receive the vaccination. Unfortunately for that day, many people canceled, which led to 135 doses not being administered and in turn wasted. The overall problem is simply this. The manual reconstitution steps are slow and lead to errors, sometimes deadly, burdensome labor requirements, and costly wastage. This is not a small problem. Doses of reconstituted vaccine given around the world run in the billions each year. Vaccine Systems has designed a patented portable device, the AVRS, that, for example, reduces vaccine preparation time for 30 Pfizer COVID vaccine doses, or 5 vials, from 25 plus minutes to just 2 minutes. It can be operated with a single tap on a touchpad. This can speed and improve vaccine deployment by reducing bottlenecks at the point of care, helping to ensure accuracy of reconstitution and prevent mistakes, lowering the risk of vaccine waste, and easing the burden of staffing and training. Today, it requires at least 9 cumbersome steps to reconstitute, starting with the diluent vaccine match, through the preparation of the syringe and insertion of the syringe in the diluent vials, and then in turn the vaccine vial, followed by agitation and reconstitution of the vaccine per the FDA insert, and then a visual check to see if the vaccine is properly mixed. With the AVRS, a single tap of the touchpad enables caregivers to, for example, mix 30 doses of Pfizer COVID vaccine in 2 minutes instead of 25 to 40 minutes, greatly simplifying and de-risking mass vaccination campaigns on the front lines. Last August, the UN and World Health Organization credited Dr. Oyewale Tamori as the leading virologist who helped spearhead Nigeria's efforts to kick polio out of the country. Dr. Tamori, who is currently chair of Nigeria's Expert Review Committee on COVID-19 and advises the World Health Organization on the pandemic in sub-Saharan Africa, wrote about us. Vaccine Systems, AVRS, will contribute significantly to reducing vaccine wastage and ensure delivery of correct and adequate amount of vaccine to the child and save many more children from vaccine-preventable diseases. The competition is the current manual method and the momentum associated with that. The AVRS offers significant competitive advantage in the attributes of vaccine wastage, error rate and accuracy, training and staffing, and speed of preparation. A patent portfolio protects this competitive advantage. In validation interviews, frontline vaccinators and industry leaders have told us they want the benefits of our system. Pharmacists, nurses fighting Ebola in the DRC, MSF epidemiologists, and family practice doctors here in Austin have all spoken out on behalf of our system. Vaccine Systems is an ecosystem partner of the Texas Global Health and Security Consortium, a member of the Texas Health Catalyst Program through Dell Medical Center, a member of the Austin Technology Incubator, and a member of the Spring Cohort 2021 of the Texas Venture Labs Accelerator Program at the University of Texas McCombs School of Business. We can be reached at info@vaccinesystems.com, or you can learn a little bit more about us at our website at www.vaccinesystems.com. Thank you.